I'd like to talk a little bit about healthcare reform. So in 2010, the government passed the ACA, the Affordable Care Act, also known as Obamacare. And of course, it's highly controversial. Of course, all the Republicans are against it. The Democrats are nominally for it, but there are many within the Democratic camp who are criticizing it for various reasons. And I among them. In general, I count myself as a Democrat. I mean, I usually vote for a Democratic president and other Democratic politicians on the local level. But at the same, and also I was very supportive of Barack Obama when he first ran for president. But over time, I've become increasingly disillusioned with him. And one of the main reasons is the way he handled the Affordable Care Act. I think he didn't go far enough in fighting for the lower classes, for the working class, for people who were most hurt by the lack of affordable access to healthcare. And so let's review briefly what he did accomplish, and let's see why he didn't go far enough and why some of the most entrenched and extensive problems in the old system still persist. Okay, so first of all, here are the highlights of the ACA. Number one, health maintenance organizations, HMOs, cannot drop their coverage for students until they reach 26, children and adults that are still in college until they reach 26. That was one of the first things to kick in. No lifetime caps. Insurance companies are required to pay for certain preventive services. In the past they didn't. In the past they only paid for emergencies. There are various rules in place to monitor the insurance companies to make sure that they don't spend too much money on administrative costs and they don't raise the premiums too fast, things like that. What else? No ban on insurance companies cannot deny coverage based on pre-existing conditions. Okay, that's another important thing. And what else was in the law? I think, and of course, one of the most important things is that the governments will subsidize those who cannot afford to buy insurance. Now, of course, the flip side of that is, of all the above mentioned, is that everyone is forced to buy insurance. So this is called the mandate. Okay, so everyone is required to buy insurance. Now, on that, I have no issue at all. I mean, requiring people to buy insurance, I know that this came in front of the Supreme Court, and it was argued that, the broccoli argument, like, can you force somebody to eat broccoli? I think it's a ridiculous argument, because, I mean, it's like saying, how much does this country, does the United States spend on defense? It spends $600 billion on defense. And can I say, well, this is not consistent with liberty, like, why are you forcing me to spend money on defense? I am a pacifist. I don't want to spend. You can't force me to spend. Would that be a valid argument? Well, of course not. But there's a thing called a social contract, a social compact, and people are bound to each other. You can't just say, I'm an individual and I want to do my own thing. So you can say it in some respects, but you cannot say it with respect to certain basic requirements that we as a society deem necessary for everyone. Okay, this is like a certain floor below which nobody can fall. Right? We're saying basically that nobody wants an enemy invading our homeland, right? Everyone. Now, if you happen to disagree on that, I mean, too bad for you, because there's so many people who want a concerted, organized effort to protect the homeland that we're not going to take your libertarian concerns into account. Okay, so we're going to force you to chip in to pay for that in the form of taxes. And the same thing applies here, so I'm not concerned with that. But the other things, but on the other matters that I just mentioned, I think that we're being completely misguided. And the proof of that is that, and I'm going to get to that in a minute, but the proof of that is that we didn't enact tort reform, and there's nothing in the act that really changes on a fundamental level the way healthcare is understood and practiced and delivered in terms of minimizing the cost. of healthcare, in terms of reducing the cost. Because one of the biggest problems in the healthcare industry is that we're spending way too much money and we're not getting good results. And this has been documented extensively by everyone who has studied the matter, that compared to other developed countries, they spend less and they get better results. So that's one of the biggest problems we have in the healthcare industry, and the ACA doesn't seem to be addressing this. Now, I know they try to implement various things, better technology, and of course the mandate on preventive care is also expected to help on this. But I think that the biggest culprit in this outrageous cost of healthcare, outrageously high cost, the biggest culprit has not been addressed by the ACA. And so I'm going to enumerate some of these things, in my opinion, that drive up the cost in a very irrational and irresponsible way. And it should have been dealt with either by law or through some other matter. But like I said, nobody talked about it, nobody's concerned about it. All we care about is having the government come to our rescue and giving us another program. Okay, so this is, I think, why it's a little misguided. We don't want another program. We don't want another government program, a welfare program, to tell us, yes, we're gonna ensure that you don't fall through the cracks. I mean, that's an important thing, but at some level, I mean, I understand that, but ultimately we need a lot more than that in order to address the real issue here, which is that we need to curb the cost of the actual healthcare. So let's see some of the reasons why healthcare is so expensive. Let's start with the whole concept of insurance in the first place. Now, I'm in China, for example, right now, and here the concept of insurance almost doesn't exist. When a person needs, take healthcare, for example. I've been to the hospital many times, and it is routine, it is normal, everyone just pays their own bill. Now, of course, the hospital bill here is much, much, much smaller than in America, and it's not just because the standard of living here is lower, it's just because they have a much more efficient way of delivery. For example, you don't go to a private doctor here, you go to a clinic. You don't have to waste time making an appointment. You don't have to waste time with all this extensive paperwork. There's no paperwork at all. You just walk in, you register a card, and you pay a small fee to see a doctor, and the doctor makes a prescription. You pay again before you get treated, and then you just go online, and it usually goes pretty fast, and you get treated. You get the blood test or whatever you need done. The blood test here is incredibly cheap. I mean, I've done it many times, and it's like it costs like 36 kwai. What is that? $4, $3, and the reason it is so cheap is that it is very streamlined. You have one nurse serving thousands of people on a single day. Okay, you have like one nurse, two nurses, whatever it is, but it's extremely streamlined. They have one or two machines. They read all the blood tests. You don't have to transport it here and there and outsource it to this other person. Like, it's so inefficient the way it is done in America. The way you go to a doctor, you don't go to a clinic, you go to a doctor, and there's like 3 doctors on the block. Like, what the hell is happening there? Why can't you go to a centralized, organized place where they can do it for you? And also you wait so long. Last time I went to a doctor, I waited for an hour, and this is after getting lucky to get an appointment, right? I mean, when you first pick up the phone, you're hoping to get an appointment day of or tomorrow, and usually you're not going to get an appointment when you want it. So the way we do healthcare in America is very inefficient. But like I said earlier, the problem here is that the concept of insurance. So in less developed countries, or even in perhaps in Europe, I'm not familiar with Europe that well, but it seems to me that Americans have a peculiar obsession with getting insured. We have insurance for our cars, our vehicles, our house, title insurance when we buy a house. We have insurance when we buy electronic products, we buy warranties. Everyone is obsessed with that. We have insurance, all sorts of car insurance, collision and liability. We have malpractice insurance and all that. The problem with insurance is, here's the problem, there's various problems with insurance. on a small scale, when you need it, to the extent that you need it, it's totally okay. It is a very good and beneficial product. The problem is, if you use it indiscriminately, especially when it becomes so comprehensive and so de rigueur within a certain industry, such as in the auto industry, where it's absolutely required by law, and in the healthcare industry, where once again, for some reason, it has become normative. The problem with that is that it actually changes the whole way that the damage is being assessed. In other words, it drives up the actual assessment of the damage. When a person pays out of pocket for damage, then they are seeking to minimize the assessment of the damage, or minimize the cost of fixing that damage. Okay, because they're paying out of pocket. So, for example, if there wasn't any auto insurance, and you just, and there's a problem, you get into an accident, and your car sustains damage, so you would go to the cheapest body shop, right? You would go to the cheapest, the most effective, whatever. You would use the open market to go to a repair shop to have your car fixed, and you would pay, and you would negotiate, and you would stay on top of the repairman to ensure that he does a good job at a good price. The problem with the insurance company is a third party, and the insurance company doesn't directly oversee the process of repairing the car. The insurance company is aloof. They are not involved in the activity, and what they have to do is satisfy you. And you are trying to squeeze out the insurance company because you've paid your premiums. So suddenly the whole dynamic shifts here. Instead of just getting the car fixed, it is what you want is, in the most efficient way, instead of getting the car fixed in the most efficient way, what you're trying to do is getting the most out of the insurance company. The presumption is that the more you get out of the insurance company, the more it justifies your premium. This is a huge misconception, I think, in my opinion, because it's short-sighted in the sense that it doesn't take into account the way your premium is going to rise if you make excessive claims. And the insurance companies, of course, try to fight this by putting downward pressure on all those high assessments of damages. But the problem is that they've given up because the consumer is just, yelling that I paid so much money. How are you gonna deny my claim? And so insurance companies over time they've said, you know what? I'm not gonna fight you. You want me to grant a high claim? Have at it, Hoss. You can take it. I'll give it. I'll grant you the claim. And this is why they're not even fighting fraud. So once again, the insurance is skewing the whole way the industry works. Because if somebody were to commit an act of all these acts of fraud, there's various ways of committing auto insurance fraud. But one of them is a staged accident, for example. Another way is by after the accident, you can actually increase the damages, physically. Just take a hammer and just bang up the car even more. And nobody has taken a photo. Nobody knows exactly what it looks like. And there's a police report, but the police report doesn't describe all the damages. And then you can submit a higher claim. So there's all these ways of doing this. And like I said, and there's nothing. So basically, you're trying to squeeze out more from the insurance company, and the insurance company sometimes is very suspicious about it, but they can't prove it, and they're not even interested in proving it that much because it's not their bottom line doesn't suffer. They simply raise the premiums, and this is especially the case, and since it is mandated by law to buy insurance. So basically, everyone is trapped. All the consumers are trapped in a vicious cycle, right? They pay more, they demand more for their premium dollars. And the insurance companies are saying, you know what? Okay, I'll give you more, and you'll pay more. You're required to buy my product anyway, right? Okay, so here, have it. And the more the consumer pays, the more they in turn demand, and so it keeps rising, it keeps spiraling like this in a vicious cycle. So this is the problem, and this is the same problem in healthcare. The same exact problem. You're paying money, and then you're demanding, oh, I paid money, so give me quality care. And no matter how good the quality is, you're always asking for more. You're asking for more. And the insurance company is tired of fighting you, and they simply say, okay, no problem, here, have it. What, you want an expensive test? You get it. You want another test? Okay, I'll give you another test. Okay, I relent. Have it. And they start raising your premium. And to some extent, the fact that employers get involved in this makes it even worse. Because now instead of just three parties, meaning the consumer, the healthcare provider, and the insurance company, now you also have the employer. So now you're not even aware, you don't suffer the repercussion of being excessively selfish when it comes to extracting when it comes to extracting benefits from the insurance company, because it is so diluted and is so indirect, because you are part of a group, right? The employer group. The group deals with the insurance company deals with the clinic. So it is so indirect, nobody knows. You're not accountable for your actions. When you walk into the doctor and you're asking the doctor, give me another test, right? The doctor will give it to you, no problem. I mean, there's nobody there to tell the doctor, like, to put downward pressure at all. And if you were paying out of pocket, then of course you wouldn't easily ask for another test. You would ask the doctor, is this appropriate? Is it not? Advise me well. And if the doctor doesn't advise him well, and if the doctor tries to extract more money because it's in his best interest, in his bottom line, then you wouldn't come back to that doctor, right? You would consider that a violation of their ethics, and market dynamics would dictate that you wouldn't come back to such a doctor if it were out of pocket. But it's not out of pocket, and so the exact opposite happens in the sense that the doctor actually wants to give you more, and the reason for that is, which brings me to another concept, which is, and I alluded to that earlier, is the problem with the way tort is practiced, the way malpractice is being treated. So as it stands right now, the doctors pay a huge amount of money for malpractice insurance, and the insurance lawsuits and the malpractice lawsuits are also obscenely high. And the reason they're so high is because the lawyers have managed to convince people that these wealthy doctors or these wealthy insurance companies have so much money, they're so rich, and here you have this poor person, this individual citizen, and he's a customer, and he's paid money, and now they've mistreated him, it was so negligent, and these things go to a jury, and the jury is of course stupid, they don't understand what is involved in the matter, and they just simply award these outrageously high damages. And the lawyers know that, and the defense knows that. Okay, this is an important thing. So the defense, even though everyone realizes that the amount that they're suing for is crazy, it's insane, there's no way that any rational person would ever justify such a claim. But the reason they do that is to get leverage in the negotiation process. It doesn't go to trial, but they negotiate let's say 50% or 40% or whatever it is, and then the lawyer takes a nice chunk of it, and then of course the person who barely got injured in the first place, I mean, the whole suit was dubious to begin with, so for that person it's just a windfall. Either way, I mean, it's just, I'll grab whatever I can take, because it's really not the consumer's lawsuit, it's really the lawyer's lawsuit. The lawyer has just convinced them to just put his signature on. So the whole thing is really crooked, it's really corrupt, and it really needs to be reformed. And so the tort is also a reason. So here you have another example how insurance just screws the whole thing up. Now, once again, if there was no malpractice insurance, and if it was really the person against the doctor, then the juries wouldn't be as sympathetic. The whole thing would change. So just to reiterate, what I'm trying to say is that the insurance really distorts the way the whole thing is viewed and practiced, and the way money is being allocated to the different parties. And so that's one thing. Now I wanted to mention one more thing, very important, And if you're still with me, which you probably aren't, but okay, so here's the other thing that I wanted to talk about, and that is that Americans, unlike Europeans, feel a sense of entitlement. How did this happen? Okay, so you know what? I'm gonna make a separate video on this. I'm gonna do part 2 because I don't want to go over 20 minutes. Okay, join me in part 2.